So fixing that requires us to do a couple things. Number one, realize that providing healthcare for people is the right thing to do from a moral perspective, right? And if you start with that, it's easy to make the rest of the decisions, even when they may pinch a little bit. We need to get rid of the profit-taking health insurance companies. Their only role is to take insurance premiums and then deny care. That's their business model. That's their profit model. And when we get rid of them, we will drive down the cost of providing care. And there are folks out there, maybe even that are watching right now, who fear government-controlled healthcare. I am here to tell you from my personal experience, if it's done right, it's great. I lived under it for 35 years when I was in the military. The Air Force provided my medical care as a direct benefit to me being in the military. It provided my family their health care. And in 35 years in the military, I was out of pocket less than $30 the whole time. And that was because my wife had to have meals when she was in the hospital with our first son in Germany. And contrary to the myth, the healthcare that we got, that I received as a military member, wasn't a reward for my service. It wasn't like, okay, you're risking your life, so therefore you get free healthcare. The real answer to why they give us healthcare is because if I'm not healthy, I can't make the mission happen, right? I can't fly my fighter if I'm not healthy. And if my family's sick, I can't be focused on the mission. And if my family's sick, or if I'm covered in medical debt, I'm distracted from the job at hand. I'm not productive in my role, and they're not productive in their role. That is everything I just said is true in the civilian world. If we get this medical debt threat away from people, encouraging them to seek preventative medical care, get their prenatal care, get their baby checkups, and then when the first sign of illness, go to a doctor and get it taken care of. It drives down the severity of illness. It drives down the cost of treating those illnesses. And all those people have a chance to spend more time at work, contribute to the economy, more time in school, less absenteeism. It's better in every category. And anybody who doesn't believe that need only visit any one of the other countries out there. And before I shut up on this topic, I'll say that there will be someone maybe in the chat, because I can't have my reading glasses on if I can't read it. They're saying, wait times. Yes, your cousin's friend knows someone in Canada who had to wait in line for their knee replacement. That is part of the deal sometimes, because when you're waiting for that elective surgery or that not critical surgery, some kid is getting their cancer cured. Some kid their life is being saved, or your neighbor's life is being saved. And waiting with a hurt knee for 3 months to allow that to happen, that's an easy call for me. More importantly, I think the argument back to that is, under the current model, you never get the treatment. What's worse, a wait time or never getting the treatment? Because most Americans can't afford to get major healthcare coverage. They wait till something's an emergency, and then there's a risk that they're going to lose their house or lose their retirement to cover it. So it's morally insane that we handle it this way. It's an easy fix. It'll be expensive, but the payoff will be massive.